Good morning to all. Today we will discuss about muscles of face. Start with content, and content include introduction, various muscles and their action, their innervation and applied anatomy. Start with introduction. The facial muscles are a group of stated skeletal muscles innervated by facial nerve which control facial expression. These muscles are also called mimetic muscles. Facial expression movement of mimetic muscles of the face. The facial musculature is fairly unique. They include the only somatic muscles in the body attached on the one side to the bone and the other to the skin. Thus, facial muscle movement are specialized for expression. The face is also one of the few places in the body where some muscles are not attached to any bone at all. They also act as a sphincter and dilator of the orifice of the face. The facial muscles develop from the second pharyngeal arch. The facial muscles are a group of muscles which divided in various groups. For logical understanding, we divide the group of muscles in four groups. The first is orbicular group, and second nasal group, third oral group, and fourth is other muscles and group. The orbicular group. The orbicular group include orbiculus oculi, levator palpebrae superioris, and corrugator supercilii, and nasal. The orbiculus oculi muscles of action is close and squint the eye and wink, concern and perplexion. Levator palpebrae superioris muscles, the action of these muscles elevate the upper eyelid in surprise and fear. The corrugator supercilii muscles, the action of this muscle draw the eyebrow inferior medially and show anger and concern. The nasal group include nasalis muscles. This muscle originates from the maxilla to the cartilage of the nose and opposite side of the nasalis muscle. The action of this muscle is compress the nares. The processus muscles, the processus muscle originate from the fascia and skin medial to the eyebrow to the fascia and skin. The action of these muscles is over the nasal bone, the distant look, and depressor septi muscles. This muscle originates from the medial fiber of the dilator nares muscle to the mobile part of the nasal septum. The action of this muscle is depressed septum and narrow nostrils. The oral group of muscles include levator labii superioris. This muscle originates from the infraorbital head and zygomatic head to the upper lip. The action of this muscle is raise upper lip and help form nasolabial furrow and disgust and smugness. The second muscle is levator labii superioris alacnaceae muscles. This muscle originates from frontal nasal process to one to ala and other to orbiculus oris muscle. The action of this muscle raise the upper lip and open nostrils in anger. The third muscle is levator anguli oris muscle. This muscle originates from the maxilla below infraorbital foramen and canine fossa to angle of the mouth. The action of these muscles elevate the angle of the mouth in smile like Dracula facial expression. The zygomatic major muscle. This muscle originates from the zygomatic bone and arch to angle of the mouth. The action of this muscle is draw the corner of the mouth in upward and laterally in smile and laugh. The zygomatic minor muscle. This muscle originates from the zygomatic bone and medial to the zygomatic major to nasolabial groove. The action of this muscle is draw the upper lip in upward in smile and smugness. The rhizorius muscle originates from the superficial fascia over parotid to skin and mucosa on angle of lip. The action of this muscle is retract the corner of the mouth in grin, smile and laugh. The depressor anguli oris muscle. This muscle originates from the oblique line of mandible to angle of the mouth. The action of this muscle is draw corner of the mouth down and laterally. The depressor labii inferior muscle. This muscle is originated from the base of the mandible to skin and mucosa of upper lip. The action of this muscle is draw lower lip in downward laterally in sadness and dislike movement. The mentalis muscle is originated from the mandible below lower incisor to the skin of the chin. The action of this muscle is raise and protrude lower lip as it wrinkle skin on chin in doubt and pout in facial expression. The orbicular oris muscle, this muscle originates from the buccinator muscle to angle of the mouth in upper lip and mandible in lower lip, and this the action of this muscle is close the lip and protrude a lip and perking and whistling and facial expression. The buccinator muscle originates from the elevator process of the facial maxilla and mandible in the region of molar and pterygomandibular ligament. The presses this cheek against the teeth, the compress distant cheek and pucker and extends and sign muscle. The platysma, this muscle originate from the skin and superficial fascia of the pectoral and deltoid or region of the lower body of the mandible. The action of this muscle draw up the skin of the superior chest and skin. And the other group include the occipitofrontalis frontal belly muscle and occipital belly muscle. The occipitofrontalis frontal belly muscle originates from the anterior part of glia aponeurotica to skin on lower part of forehead. The action of this muscle in wrinkle forehead and raised eyebrow. The occipital belly muscle from lateral two-thirds of the superior knuckle line to posterior part of the glia aponeurotica. The action of this muscle is draw the scalp in backward direction. The anterior auricular muscles draw the action of this muscle draw ear in upward and forward direction. Superior auricular muscle elevate the ear. The posterior auricular muscle the door in upward draw the ear upward in backward direction. These are photo of these muscles. Nerve supply to the facial muscles, which is supplied by the facial nerve. This is seventh ciliary nerve. It is emerged from the brainstem between the pons and the medulla, and it controls the muscles of the facial expression. The facial nerve is developmentally derived from the hyoid arch, which is second pharyngeal arch, brachial arch. The motor division of the facial nerve is derived from the basal plate of the embryonic pons, while the sensory division originates from the cranial crest. The facial muscle exit from the stylomastoid foramen, which is further divided in five in temporal, zygomatic, buccal, and marginal and cervical and posterior group from the parietal gland. The orbicular oculi muscle, which is supplied by the branches of the facial nerve like temporal and zygomatic branches. The muscles of upper lip and buccinator, levator anguli oris muscles is supplied by the buccal branch of facial nerve. Rhizorius and muscles of lower lip, which is supplied by the mandibular branch, and platysma muscle, which is supplied by the cervical branch of the facial muscle. The applied anatomy of the facial muscle. The Bell's palsy first described by the Charles Bell in 1821. It is a common acute benign and neurological disorder characterized by the sudden isolated peripheral facial nerve paralysis. The facial palsy is also known as a lower motor neuron disorder. The etiology of is various and unknown etiology include infectious, genetic, metabolic, autoimmune, vascular condition, nerve entrapment, and viral etiology. The clinical feature of Bell's palsy can be complete and partial. Only lower part of the face is involved. Lack of facial expression on one side. Patient is also unable to whistle, smile, and increase lacrimation, hypersensitivity to sound, loss of taste, metallic taste, and pain near mastoid area region. The sudden facial weakness, difficulty with articulation, and inability to keep in close eye. The clinical evaluation done for the exclude other etiology of the for Bell's palsy like trauma, otological disease, intracranial history can be taken for onset, course and duration, and facial crease and usually fold are disappear, forehead unfurrow and corner of the mud droop, and eyelid will not close, and lower lid sag. Tear production decrease but appear to tear excessively as loss of eyelid control. The diagnostic evaluation include to determine whether it is central or peripheral. In peripheral facial palsy involve all the facial muscle ipsilateral to the side of the facial nerve involvement. The central involve facial muscles contralateral to the lesion of the brainstem above pons and cerebral hemisphere. In diagnostic evaluation, family history can be taken. It is sudden onset and gradual. A physical examination to rule out Ramsey-Hunt syndrome, serological tests like ELISA, PCR, electrical tests like done like transtemporal stimulation, electromyography, nerve excitability test, and conventional radiography like CT, MRI. The Bell's palsy further divided into lower motor nucleus and upper motor nucleus. The lower motor nucleus lesion of the facial nerve, also known as Bell's palsy, the whole of the face of the same side is get paralyzed. And upper motor neural nucleus, the lesion of facial nerve is usually a part of hemiplegia. In lower motor nucleus, the face becomes asymmetrical and is drawn up the normal side. In upper motor nucleus, only the lower part of opposite side to the face is paralyzed. In lower motor nucleus, the affected side is motionless. In upper motor nucleus, the upper part of the frontalis and orbicularis oris escape due to its bilateral representation in the cerebral cortex. In lower motor nucleus, the wrinkle disappear and eye cannot be closed. And upper motor nucleus, these features are not presented due to the bilateral nerve innervation. And upper motor and lower motor nucleus, the peripheral palsy and also known as peripheral palsy, and upper motor nucleus also known as a central palsy. The orbicularis oculi, this much if any injury to the nerve supplying orbicularis oculi, it will cause paralysis of the muscle. This cause of drooping of the lower eyelid called as ectoropion, stippling of the tears is called epiphora. Tetanus is a clinical diagnosis characterized by a triad of muscle rigidity, muscle spasm, autonomic instability. The causing factor is Clostridium tetani. Spores enter into the body through any abrasion on the skin. Release tetanospasmin also is a potent neurotoxin. The clinical feature of tetanus is early symptom of tetanus include neck stiffness, sore throat, dysphagia, trismus. Spasm extending to the facial muscle cause the typical facial expression Rhiza sardonicus. The congenital disease like Mobius syndrome, it is an extremely rare congenital neurological disorder which is characterized by the facial paralysis and the inability to move the eye from the side to side. Most people with Mobius syndrome can be born with incomplete facial paralysis and cannot be close their eye or form facial expression. Limb and chest ball abnormalities sometimes occur with the syndrome. The Melkerson-Rostenthal syndrome, it is a rare neurological characterized by the recurring facial paralysis, swelling of the face and lip, usually upper lip, and the development of folds and furrow. Ramsey-Hunt syndrome, peripheral facial nerve palsy, may be unilateral, bilateral, vascular rash on the ear pain, tingling, tearing, loss of sensation, and nystagmus. Ramsey-Hunt syndrome type 2, reactivation of the latent herpes zoster virus within the dorsal root ganglion of facial nerve is associated with the vesicle affecting the ear canal. These are my references. Thank you.